here with me.
Thank you.
Which, by the way, everybody should check Dr. Zamazing's Instagram. Please go and follow. You can't forget about that. Dr. Zamazing. So yeah,
amazing, but with an S. There you go.
So if you guys want to see more of his before and afters, which you are asking, we are posting there and some cool advice as well. So you guys should check it out.
Yeah, trying to add pictures, daily or some posts daily. Yeah, definitely add. We'll be adding the specials there, the before after. So it's in the works.
Talking about specials, we have something special going on.
Yeah, I think they're asking about it.
Yeah, we are doing a great special. One of those $9.99 mommy makeovers with kind of all inclusive, which is nice, with the hotel, the care, transportation, all the goodies that we give you. That beautiful Top Aesthetics bag has all the foams, the fajas, and all of that. It's like $400-500 of worth of products that you're gonna get with the arnica peels and the creams and scar gels.
Yeah, it's great.
Yeah.
To just be given that and not have to worry about it. You get it at your pre-op or at the hotel. So everything's included, stress-free. Get your surgery and just relax and
we like
enjoy.
To do that. The stress-free. It's stress-free. I mean, surgery is stressful enough.
That's what we should call it, right?
Yeah.
Stress-free special.
We include everything in one place, and it's very safe, which is the nicest part.
So someone asked about why the price differences. I'm new to the practice, so we just want to ramp things up, get going.
Exactly.
So we thought that's a way for you guys to
an incentive to book. Remember that everybody that works at Top Aesthetics, we warranty to have excellent results. So that is off the question. So I think it's also a matter of doing the surgeries efficiently under the same safety guidelines that we use for everyone, and of course we want to stimulate the newer docs in the practice, so that's why we do that. So
and like we talked about last time, a lot of those, especially the bigger cases, we sometimes even work together. So it's just we're together, we're here both all the time. So even though there are those price differences, it's more of an incentive, but a lot of times we actually work together. So.
Yeah, absolutely. We'll definitely guarantee the amazing results. And with Doctors Amazing, it's even more amazing. So you can, absolutely.
I need to just take you out with me on Las Olas, promotion 24/7.
No, I think it's and actually, we had a lot of bookings, so it's nice. It's coming. I think you guys are going to be enjoying a lot of the before and afters that you're going to see from Dr. Nassiri. I think you're going to really like it. So feel free, enjoy, and I think price-wise, it's really good. Remember that while our pricing I seem obviously to be more expensive than cheap places, we offer a whole different level of service. When it comes to safety, number one, everything is is controlled by us. We monitor you closely after surgery. We know how you're doing. It's crucial, crucial. I don't know how can I emphasize it. Things happen, and if it's under our control, then you're good. Then it's outside our control. Like if you go home and we are not monitoring you, these things are important. And when you put all that together, along with the level that we provide those services on, it's like a super, super bargain. Literally, it's.
I mean, with all these services, it's an unbelievable, deal, and we do all this for your safety, just to make sure that we're not just operating and forgetting about you. You're literally with us the entire time, and we're monitoring you just to make sure everything's okay. So.
Yeah, and I agree. I agree with many of you. It says don't just look at on the price. And it's true. I mean, in this. But again, if you're looking on the price, please compare what they are offering for the price, and that is something. Obviously, you can't put a price tag to safety, right? But we had the safety checked, done. You'll be super safe with us, If that out of the question, which it should be everywhere, but unfortunately it's not. But let's say now you're going to a great plastic surgeon, great results, great reputation, safe practice. Then what else are they offering for the same price? Are they giving you a recovery place, like a 4-star hotel? Are they giving you recovery assistance? Are they giving you massages? Are they giving you a bag full of goodies with everything that you're gonna need? Are you gonna be monitored by the practice? So ask these questions. These are the important questions you want to be asking, and this is when comparing apples with apples.
Yeah, ask. Do your homework. We're not saying come here, but do your homework. Ask. Is my doctor going to see me? Who's going to monitor me? How am I going to have? It's just so you get to choose where you want to go. It doesn't have to be with us, but that you feel comfortable where you go.
Absolutely.
We got a question. What's the difference between a mini tummy tuck and a regular tummy tuck? Dollface wants to know. So mini tummy tuck is when you don't have that much excess skin. Really, it's just located in the lower, and we're also not repairing any of that muscle. So a lot of times when you're, massive weight loss or pregnancy, you get that muscle separation called diastasis. And with an extended tummy tuck, we're able to lift the whole flap and suture those muscles and bring it together. So with a mini tummy tuck, since we're not going all the way past your belly button, we don't, get to do that. So a mini tummy tuck, it's usually reserved when you have a little bit of skin laxity, mostly in your lower abdomen. We're not really addressing the upper portion, and those would be the candidates for a mini. But if you've been pregnant, massive weight loss, have a lot of skin laxity, for the most part, most of the time, you agree. We usually go for the extended, even if that means getting a little vertical incision on the bottom, because we're able to suture those muscles and really get that nice, perfect looking, kind of snatched, results. So.
I don't think there are very many candidates for mini tummy tucks, to tell you the truth, because you have to be skinny. You don't have to have a muscle separation that Dr. Nasseri just mentioned, and you have to have just a little bit of skin below your belly button. Those patients are almost non-existent. Most patients will need either a standard or an extended tummy tuck or a circumferential tummy tuck sometimes, So there's somebody logged in here, but I'm not sure they want to talk to us because they're not showing their faces. Hello, somebody there.
It's
Yo. It's Yo is there, but she doesn't want to talk to us, or he does not talk to us. So.
Hi, Dr. P.
Hey, how are you?
I'm fine. I saw you 2 years ago. I just wanted to know, is it too soon to back for a lipo?
No, 2 years is great. Actually, we recommend 1 year. 1 year is enough to separate your surgeries. I think it's a good amount of time.
I actually did the and also I did the breast implants 2 years ago as well with you. But I did scar really bad, and you did warn me about that. I was wondering if you had any new technology that would hide some of that scarring.
Yeah.
Good
so
question.
Yeah, that's great. When we know that you have history of poor scarring or keloid scarring, and you have a tendency to do that, we inject the scars, the incisions, and the new incisions, or the scar revisions in your case, with steroids. The steroids injections will prevent or will decrease the chances of you developing a keloid, let's say. But it's something that you might need to do it again, like the injections. It's something that we might need to do every 6 weeks or so. So if you're not local, you will have to either come back or have somebody local, like a dermatologist or another plastic surgeon or a PCP that is willing to do steroids injections in your incisions, as to prevent from the scar to get thicker. But we are more than happy to revise your previous scars during your next procedure. We're definitely happy to do that, and yeah, we'll inject it with steroids to prevent that from happening. We'll also provide you with the scar gels, which I'm not sure if we provide you. If you did it while I was in Top Aesthetics, we probably provided you the scar gels, but we'll provide you that again.
Yeah, you did. You provided the scar gels. I also purchased them on my own. I just didn't heal
Yeah. Did you do
because of my skin?
Did you do any steroids injections or no?
I did not.
Okay.
I traveled from Virginia
to
see you, so I didn't get a chance to do that. So I was just wondering. So maybe I can. I really didn't want to trust anybody after seeing you, so I just wanted to. So I'll just come back. I'll put myself back on the schedule because I definitely need another lipo.
No, that's perfect. Yeah, and did you have the tummy tuck done? What procedure did you have done?
Yes.
Yeah. Okay. Perfect.
I did the extended tummy tuck, the inner thighs, and breast augmentation. So
perfect. Yeah, we're more than happy. Send us the consult again.
Something happened with the stomach.
Perfect. Now, and you know, that's one of the things. The lipo after tummy tucks looks great.
Okay.
Yeah.
But it had nothing to do with you. I think it had something to do with working from home. So.
Yeah. Well.
I'll put myself on the schedule.
I'm sure. Even if you put on some weight, you look great. You know, because that happens to all our patients, and sometimes I see the patients back, and they say they gain 10 to 20 pounds, and they had a tummy tuck, and they look amazing. You know, and I always tell them, sometimes patients are even in the obese category, like a BMI is over 30, but they definitely don't look obese. You know, they look great. I tell them, hey, put the other 50%, just do a little bit more diet, and your results are going to be even better. But I'm sure it's definitely you have a very nice result. We're just going to make it look a little bit better with more lipo, because now we can give you definition. So it's nice.
Okay, and one last thing. I heard about the mommy package. Do you have something just for lipo? But I thought be able to get that because I get the revision too.
Yeah, absolutely.
So we'll figure that out when I make the phone call.
Of course, send us the consult online. We just submit new pictures so we can see where you stand. Just obviously write in the comments that you are a returning patient, and we'll work with you absolutely.
Okay.
Yeah.
Thank you so much.
No, thank you very much. See you soon.
Bye bye.
So for the Top Aesthetics Instagram viewers, the question was about scar revision. I don't know if you were able to hear that. So most of the time after we brushed up on this last week a little bit. You have a tummy tuck. We try to pull as much as we can to get your abdomen to look really, really nice. That scar is under tension. So whenever you have a scar under tension, it's not going to heal very nice. So when you come back, if you decide you want to improve that scar, there's things you can do non-surgically. We offer them at the med spa. There's, lasers, lights, all sorts of stuff. Or there's injections we can inject if it's a keloid or something like that. Or we can just, now that you come back, as early as a few months down the road, if you want to add lipo, we want you to wait a little longer. But if it's just a scar revision, come back. Your skin isn't under tension. We just revise it and go from there. But there are stuff we can do non-surgically as well. Let's see questions. I'm trying to wave at everybody here. How long do you have to wait for second round lipo? We usually like to stay a year so that inflammation and everything sort of subsides, and that way we can truly assess what areas need lipo and do it without that much bleedings, more so to say as well. I don't know if you're the same.
I do the same, yes. 6 months is the minimum, but I think it's a little bit too early to proceed because you want all that scarring that happens to be mature underneath your skin, to the tissues to be soft in order to get the best results. So I think definitely a year is my preference.
Gypsy Gaines, how quickly does it heal from a revision? You're good to go. I mean, we're not suturing muscle. We're not, doing extensive lipo. You're good to go in a couple days if you wanted to really get back to work. So it's literally just removing that scar. A lot of times, if it's a dog ear, small, we can even do it under local right here in the clinic without you going under. So that's really, really quick in terms of revision.
So Dr. Palladino, I'm 1 year post-op. I think am I hurting myself by continuously getting shots and massages? I'm not sure what kind of shots. Hopefully not COVID shots constantly, because is constantly getting shots and massages. The massages will definitely not hurt you. And the shots depends on what it is. You know, I'm not sure what you mean by getting shots, but hopefully not. So maybe you can explain a little bit better what type of shots you're mentioning, and then we can tell you if that's gonna hurt you or not. But no. So there was a question about BMI, and let's do something since we're here. We're gonna show you our beautiful new website, which is right behind us. Let me show you, since you asked about BMIs. Check it out. This is a new website, topaesthetics.com or La Sola Med Spa, and then you can see there. You can actually go to either one, but let's pick here the surgery. So you go to surgery, and then in resources there's a section that says BMI guide, and you can go to BMI guide and then check your eligibility. You will here you have a little table that tell you what you are the best candidate for. You know, they have videos that, you know, orientational videos, and I think that's actually a good resource. So let's say that you're a BMI of 32 and you want a tummy tuck. So here it is: face, tummy tuck, or breast, or combined procedures. If you are 32 to 35, you are questionable. You know, so if it's just for liposuction and fat transfer, you are probably okay. You know, so it's good to see that. But the best thing you can do is actually go here where it says book now, and then send us, submit a form, get a free consultation. You filled up this form, and boom, we will tell you what you are a best candidate for. So it's simple. That's the best thing you can do. But if you want to read a little more about BMIs, then check out our new website, topaesthetics.com. You can always go here. And if you want to check out the Med Spa services, which you're going to be looking at when you come for your pre-op, because the pre-op now happens at the Med Spa. You know, let's see. So you can go here and check all the services that we have at the Med Spa. You know, we have the beautiful Dr. Faith, beautiful Leandra, which is our esthetician, and then you're gonna be able to check out all the things that we can do at the Med Spa. So take advantage. That's amazing. And check out our new website. We have tons of info. What else? How long can I resume semaglutide after surgery? My advice is 4 weeks, okay, depending on how you're doing. But I think at 4 weeks you should be sufficiently recovered that you know, all your hormones will be imbalanced and everything, and you should be able to safely resume the weight loss treatment. Okay, and that will help you now. Obviously, after surgery, you look great. You're gonna be more motivated to lose those extra pounds that you still have to lose.
Jessica asked, can you do a labiaplasty surgery, I'm assuming, under local anesthesia, or does it have to be, I'm assuming, general?
Yeah.
Yeah, general.
Look, I think you definitely can do it. It's not a pleasant experience. You know, none of these, you know, surgeries that you do under local anesthesia are pleasant when you do it. It's such a simple procedure to be performed under general. And if you're just doing labiaplasty, it will be a quick procedure. Maybe we put you to sleep briefly. We don't have to be very invasive with the general anesthesia, you know, and really you will have a much better experience. Now, since you mentioned that, I think it's worth saying that there are a few procedures like labiaplasty that are great add-ons to other procedures. Let's mention, like, you were going to do a tummy tuck. And if you have a little bit of excess skin down there that you should, you know, treat, best time to treat it is when you're doing a tummy tuck, because it's an add-on. We're working on the same area. It's easy to take care of at the same time. You're doing it under general anesthesia, and, you know, you'll be recovered once for all of these procedures. And, you know, that, I think, buccal fat part removal is good. Like lipo of certain areas like the chin, the arms, the thighs are great add-ons to your surgical procedure. We have even videos on our YouTube channel that will mention these great add-ons to surgical procedures. Now, fat transfer to the face for those patients that are, you know, are in their 40s, starting to notice in some early signs of aging. Then if you put a little bit of fat, it's longer lasting than fillers, and you really sleep. So I think it's a good idea to consider doing that. I think it's, those things are add-ons that are good
especially like labiaplasty too. It's such a quick procedure, and they've actually done studies on this or asked patients about it. It's one of the most gratifying procedures because patients, really feel more comfortable. They really like the results, and so it's a great add-on, just like you mentioned. And I would even suggest doing fat transfer, with it as well to the outer or majora sometimes for that extra result. But can you local anesthesia? Yes, but it's a sensitive area. It might be easier as an add-on under general.
We are located in Fort Lauderdale, Florida. This is a few miles from Miami, a little bit north. You can fly to Miami or you can fly to Fort Lauderdale. I would recommend to fly to Fort Lauderdale, even if you are going to Miami.
Or even Palm Beach.
You can fly to Palm Beach as well, but
or if you have a private jet, Boca.
Yeah, executive airport. Here at actually Fort Lauderdale is the largest executive airport in the world. So by the way, if you didn't know that, it's nice. But yeah, so definitely Fort Lauderdale is a nice area, very accessible, very nice. They were saying if you have thyroid problems, are you a surgical candidate? As long as your problems are under control, you are. I mean, that's usually for most conditions like diabetes, high blood pressure. In our opinion, like if you have those conditions monitored and under control, with medications and so forth, then it should be fine. We will have you do the thyroid panel, some certain thyroid hormones if you have thyroid issues. If we find any problems in it, then we will have you refer to your endocrinologist to look into that and try to put things in order and then do your procedure. So the question is, the answer is yes, and as long as your thyroid problems are under control.
Palladino doll. All right, that's for using
see? I have a lot of those.
Yeah?
Yeah, there's a lot of Palladino dolls around there.
So she's asking you, when can I start on birth control after my surgery?
Birth control is, I think, 1 month is also appropriate.
4 weeks.
Yeah.
Also, what kind of birth control, but for the most part.
Yeah, that's true.
Do you guys have any before and afters for fat transfer to the face?
We have a few.
There should be a few. The problem with these is that they're not that much. Patients don't want their face to be shown. So
let me show you. So if you go to our wonderful new website, let's do it again here. Since you're asking, there should be some here. And then you go to gallery. Let's see if they put it in the right place. We're redoing all. Here it says otoplasty, rhinoplasty. Let's see, facelift, buccal fat part removal, blepharoplasty. I used to have one that says here breast fat transfer to the face. Let me see. All of these ones are facelift actually, but all those patients have fat transfer to the face. Although it's kind of unfair to rely on this because they also had a facelift. But let's see. This is a young guy that look at this. He had a lot of sunken face here. So the reason why he looked so much younger is because of the addition of fat into his face. It's interesting, when you lose a lot of volume in this area, you really aged. You can see it better in this position. So look at how hollow he was here, and now how we replumped his face using fat. Obviously, we improved his folding and drooping by doing a little bit of a lift. He has a mini facelift, but all this area around his eye is so much youthful and much better just because of what you see on the replumping of the fat grafting. So that is one thing that you can see that definitely see the difference. Now all these patients had, let's see, we can go back, fat injections. See facelift. Oh, here it is. Fat injections. These patients had fat injections. For example, this is just fat injections, no facelift. Look at the difference. It's pretty impressive actually. Almost looks like a facelift, and it's just fat. So what happens is she got fat transfer underneath the brow, fat transfer underneath the eye, fat transfer in the cheekbone right here, and it almost like lifted her whole face just by doing that. So see that? This how much fuller this area is. Look at how much sunken it was before. So I think definitely is, and this is literally it's a simple procedure that is great if you're doing like fat grafting somewhere else, like in your booty, let's say, and then you want to have replumping of your face. You can just add fat grafting to the face, and it's very, very powerful when you do this. It's really a good, overall. Let's see, we have more cases. This lady as well, she had some, tired eye look, and here we remove a little bit of fat from the eye with the lower cleft, and we replump her cheekbone, with fat. And she's young, obviously, but she looks a lot less tired now. So fat grafting is really good, especially for this area. I'm gonna put more, but at least you can see some of the fat grafting patients that I think is. I personally think it's a great addition for.
It's great, and if you're having surgery, fat is sort of the way to go for the face, and it's your own fat. It's not a filler. It's your own. It's lasting. Much. So I prefer fat than fillers if you can, and having a surgery.
Absolutely, I think of course if it's a little bit longer lasting, and also one thing that fat has is a lot of like the stem cells. That the stem cells, what happens is brings a lot of regenerative properties to the tissue that you're transplanting the stem cells along with the fat. So it not only gives you the volume back, but also brings a little bit of a fertilizer with power. In order to heal, to give you better skin texture, to thicken your collagen. So it's really, really good, much more than just fillers. Fillers is a great way to start, though. If you don't want to go through the recovery of the surgery and it be less invasive, then do fillers. And if you like it and you want something more permanent, then probably fat is the way to go. That's kind of how I will approach it. But if you're having a surgery already, then you might as well just add the fat grafting, and it really works. And I'm very happy with it. So let's see some more questions. Thank you for the wonderful job and experience so far. I'm so happy, Gloria. Thank you, Gloria. If you want to share your results here with the rest of our listeners here, I will be happy to talk to you here. How much can be transferred with a tummy tuck already had a BBL with you and need more projection? Yeah, so we can transfer 1,000 cc's, which especially if you're looking just for projection posteriorly, is great. It's more than enough, in order to give you more posteriors. That's what I always ask, especially patients that had previous BBLs. Now it's a matter of just, increasing that a little more, and definitely that will be good. So best thing to do, consultation, send us your info, send you pictures, please, and then we will get back to you with the best plan possible for you. Let's see. Meso shots. Okay, so those are the shots that you were talking about, the mesotherapy shots. They come with the lymphatic drainage. Look, I don't do mesotherapy. I know people that does a great job with mesotherapy. For those of you that don't know what that is it's a diluting of fat. It dissolves the fat underneath the skin. Some people uses it for, treat very small targeted areas of fat, sometimes in like fat deposition in here, sometimes in the legs. Some patients use it for cellulite, although I don't think it's a great use for cellulite. But if you overdo the mesotherapy, you will ruin something like anything else. If you go under somebody that has a lot of experience doing it and they do a good job at it, you probably have a good outcome. But the thing is, just don't overdo it. So you could hurt yourself if you overdo it, like with anything else. I don't know if that helps a lot, but I myself don't do mesotherapy, but I know practitioners that have great results with it. So, it's not out of the question.
Somebody was asking regarding what areas of the face do you usually add fat to. So it really depends where we see it's lacking. Most people, when they come in, so things, while you age, you lose volume, fat, your elasticity goes dry. There's also some, remodeling of the bone, so forth, we say.
Yeah.
So we want to add those areas that we think, you lost volume, and sort of restore that. Most of the time it's under eyes, it's here, sort of in your mid-face, temple area. Some people lose this, it becomes very hollow. Lips, We try to add nasolabial folds if you need it. So every patient is unique. So we would, basically target areas that you need to. Cost-wise, you can just ask the, when you
coordinators.
call, right, and they'll let you know.
It's very accessible, especially if you compare this with fillers. Fillers is going to be more costly because it's going to have to be done more frequently, and this one is just going to be done once, and then you probably for 5-10 years you don't need anything else done on this particular thing. So places that I love to put the fat grafting are the cheekbones, like you mentioned, because I think this is the areas that you lose, around your eyes and your cheekbones, and then your lips. The lips work great, I think it restores the volume at the beginning. You need a little bit of time to recover from this because the lip injections with fat sometimes swell up and you look a little bit weird for a few weeks. So it's different than fillers, but the end result is good. In fact, some patients sometimes think it goes away, and then when we show them the before and after, it remains. But it really, I think the lip fillers with fat, they do great.
Yeah. You are going to be a little bruised up and swollen, and you're going to think, oh my God, this might be more than I wanted, but it's fat. Not all of it lives. The swelling goes down. So that's really the difference between fat, in terms of how you're going to recover. Just a little bit longer with the swelling, but then after that you maintain it a lot longer.
Let's see. We have more questions here. Doctor, cuando hace una lipo, ¿se puede marcar el abdomen como cuadritos? Sí, se puede. Se llama lipo de alta definición y con gusto lo hacemos. They're asking if we can do like this edging liposculpture or high definition liposculpture when we do lipo. Now, not everyone is a candidate for that. If you have loose skin, not a candidate. If you are kind of on the bigger side, not a candidate. I think you have to be rather skinny and not have a lot of excess skin to be a good candidate for that. But definitely we can do the high definition liposculpture. You have a lot of experience with it too. And using J-plasma.
Yeah. I mean, but exactly. If you don't have, so the way that I like to do it, and what we need from you is we need your skin to retract, right? When we're creating those, etching and the definition, we'll use J-plasma, and other tools if your surgeon has it available. But we need that skin to retract. If you have loose skin and you don't have retraction, you're not going to be able to create that etching. So not every patient is a candidate for it. Some patients, if they're not a candidate for full etching, there's some areas that we can try to focus on that I can do, especially targeted areas, in men and females and so forth. But you have to be a good candidate to do the specific etch.
Hi Debbie 912. I don't remember you from that picture, but maybe if you log in here and you chat with us, we will remember. I remember. Let's see, losing weight, good. That's always a good news. Losing weight always will give you a better result. ¿Se puede hacer una marcación junto con el tummy tuck? Normalmente el tummy tuck te da una marcación natural. So they're asking if with the tummy tuck you still have to do this edging. The tummy tuck, especially how we do it, they already include the kind of the shape that you were gonna get. So you will get the best result with the tummy tuck. Vas a tener una marcación con el tummy tuck.
I think we have a question.
Let's see.
Devin says, I want to book, but I'm so nervous. Devin, everybody's nervous. You're not the only person. The coordinators will kind of guide you through it. If you ever wanted to talk to any of us here, we'd be more than happy to speak with you. I do it all the time, and I know you do it as well. So whether it's virtual, phone call, not a problem if you think that'll help, and we'd love to talk to you. And you asked about if I want to try J-plasma before an arm lift. Is that an option? So it depends on, we'll obviously take a look at your photos. If we think, oh, no way, you can't. But if you're borderline and we think you can get away with just lipo and J-plasma and you don't want that scar, absolutely, you can try. But it really depends on your photos.
I think it's very important the fact that we understand that everybody is nervous before any of these procedures. These are not, at the end it's surgery, and we're going to be cutting on your body, and this is just will make anybody nervous. And I'm so happy that we mostly treat women, because if we would be like for guys, forget it. Like that, they're chicken out like 80% of the time. So on the reverse, women are a lot more brave in that sense, and I think is great. And I really have a lot of empathy, because I can imagine the courage that takes to undergo this. Now know that because of that, we have created probably one of the safest and more relaxed environments for you, because as we understand this is very stressful, we don't want you to worry about anything. We want you to understand that you're safe when you come to us, that you're going to be well cared under our supervision, that we'll be monitoring you during and after surgery. And that's why you should be a little bit more relaxed coming to us. So I hope that everything that we had put in place with the YouTube videos, with these lives that we do weekly, will allow you to bring more peace. And like Dr. Nasseri said, we are happy to talk to you. I believe that a lot of times when I talk to the patients, especially those patients that are going to be having surgery soon, if we get in the phone for a few minutes, it's going to ease your nervousness. And we're happy to do that. Absolutely. More than welcome to come in person. I wish we could see everybody in person before. It's just sometimes logistically, because most of our patients are not from Florida. But we can definitely see you the day before surgery, talk, chat. I want you to get to surgery without any questions,
I mean, so if you can come in, please, I do consults not only here in the main clinic, but also downtown.
That's right.
At the med spa. So either or if you want to talk on the phone or do a virtual, I'd be more than happy to try to make you feel better. And we're located in Fort Lauderdale, Florida. Someone was asking.
Yeah. It says I'm seven weeks post-operation, and as soon as this week number 6, I started feeling back to normal. The experience of the surgery was easy compared to the results. Sounds like that Gloria had a great experience. That's what I'm reading the lines, and I agree. About 6 weeks, you're gonna be feeling pretty much normal.
Mm-hmm.
We always say that you're probably gonna go back to like driving and doing like normal stuff in about 3 weeks. But at 6 weeks, you should be feeling pretty normal, and probably start being released to start doing some exercise. Yeah.
Someone was asking about I put a deposit for J Plasma, but if I'm not a candidate, will you tell me, or will yes? I mean, we'll see. There's rarely any patients that won't be a candidate for J Plasma. I think it's a great add-on, but absolutely, we're not going to do something, provide you something that you're not a candidate for. And if you're not, we would have seen the pictures and told you beforehand. But yes, absolutely, if you come in and we examine you and it's different, we'll let you know.
We have a system here that you will just be surprised how not always is like this, but it should. Is that where the people that makes the decision is the surgeons. Like we made the decision. We look at your pictures and we decide. I'm very infrequently we have to change it. Sometimes we have to add something because you didn't mention it before, or we see you say, okay, can I do like lipo on my arms and things like that? Then we can add it. But very unlikely we have to change the after seeing your pictures, we can give you a pretty good just like idea what you're gonna need. So that's important, and that doesn't happen everywhere. So be mindful about that. It should be kind of common sense that whoever is gonna be doing your surgery should make the plan, right? But
from feedback from some patients, I guess they're concerned that nobody review. We see all of the consults that come to us. We review each one with the photos. And the coordinator actually sends us, these pictures.
Let me tell you something else that we do here that I want you to be just definitely take a look at this, because this is let's see if I can find it here. I'm gonna show you this. So we do simulations. So once you submit your free consultation, let me show you. We create, if you send us good pictures, this is super, super important. You have to send us good pictures. Then we create something like this. So the one side it says pre-op right here. We create a simulation of how we believe you're gonna look after the procedures that you want, or we, just plan for you. And then this is actually the same patient post-op day number 1. And this is just to show you how close they are. This not only means that we reviewed your case, this also means that we actually put the work into creating the simulation. So this is a service that we are offering it to you at no cost at the moment. So, and it allows you to tell you the level of involvement that we have with doing this, evaluation, preoperative evaluation. You have different patients. This is like for breast. Again, pre-op, simulation, early post-op. This is the same patient, but a few months later. So 6 weeks later, month and a half later, you can see there pre-op, simulation, post-op. The simulation and the post-op are very, very close, and we try to make it as close as possible so you have realistic expectations.
And fun fact, during your post-op visits, a lot of times we show you these. We take pictures of your immediate, even your first day post-op, and we show you, even while you're recovering, hey, look at this. Yeah, so that you can actually see your results. I mean, we're not trying to hide anything. We want you to actually be interactive and see all these simulations. So this is something we actually show you while you're recovering as well. So you can be like, whoa, wow, this is actually better than I thought. Or, hey, this didn't turn out, the way I want. But we want you to actually see it. So
yeah, absolutely. And I think patients forget immediately how they look before, and obviously immediately after surgery, especially day 1, 2, 3. You're in pain. You're not at your best, obviously, right? And but when you see actually the difference from the before and after, right in the first few days, most of our patients get very shocked. And then from then on, it's usually improvement. So I think that is a thing, and I like to show you this because I want you to understand how you're going to look, and if we can get a good grasp of your kind of expectations, then you're going to be happy. Most of the unhappiness comes when your results are not what you were expecting. By doing this, that's what we're trying to do that. So it says, Dr. P, I'm 1 month post-op today. I appreciate your office so much. Thank you so much. I'm happy. If you guys want to share some of your results with us, you're more than welcome. We're happy to have you and invite you here to interact with us. We even can share your screen here in the back screen. If you accidentally wake up on your side, does that harm the fat that was transferred there? What do you say?
No, you're fine. Obviously, we don't want you to, if you can not put pressure on those areas, that helps. But you just accidentally being on one area or not, will you get worse results? Rarely.
The good thing about coming with us is that we're going to be monitoring, things pretty closely, and ladies are going to be checking on you here in the hotel. And so if you spend a couple of hours or a few hours on one side, it's not going to make a big deal. It's not going to be a big difference. I mean, as long as you spend, let's say, the whole day on one side, right, right after surgery. So, and we would not let that happen. So, I think you're safe. You're safe. But it's important to keep up with a good job after surgery. What else we have to show our wonderful listeners?
Did you want to talk about the brand new?
Do you guys want to see
the patients will be rolling to the clinic with?
Let's see this. It's worth seeing. So, how we just bring this amazing concierge service, but it's continuing to get better, and we're gonna show you. This is the new transport that is gonna be starting likely next week, picking you up. So we have this beautiful, I don't know if you call it a van or we can call it I don't know. This is a little bit of a beautiful combination between an SUV and a van. But the best thing of all is this. So you have, I'm going to show you. So this is the interior. Let's see if we can bring it out some more. It has VIP chairs on the back. So this is the back row seat will fold completely in, and then these two seats will recline 100%. And it also has footrest, so you're gonna be so comfy. We're gonna put your BBL pillow here, recline you. You're gonna feel like a, literally first class transport. And it's amazing because there's some cameras here in the ceiling of the van, so you can talk to the driver and listen to with some microphones of speakers right next to your ear right here, so you guys don't have to scream. It has entertainment systems, so it has some monitors or TVs right behind the seat where you can actually see. You could see Netflix too, but we're gonna show you some of the cool stuff that we do here at the office and the services. So this is a major upgrade to your comfort level, to your safety level, to everything we do. It's literally brand new. I want to travel. I want.
Yeah, I mean, you can start by picking me up in the morning.
That's right. Why don't we start with the pickup? Yeah, so we are picking up the patients starting next week on this amazing vehicle. So if you're having surgery starting next week, you're gonna have an upgraded experience on transport.
That's awesome. That's amazing. And it really does help with it going all the way back and the footrest that way, especially for certain procedures where you don't want to lie on your back or so forth. It really does help. So
just the comfort, I think it's nice. And you have to be very careful about transportation here in South Florida. A lot of patients get transported in the back of the vans without a seat belt, and they're just laid flat not to crash or sit on your booty, and that is extremely unsafe. You should definitely not do that, because if something happens, there's a crash, involved or anything, you want to be appropriately secured.
Yeah.
And there's no other way than being, in a seat, properly sitting with a proper padding, but sitting, not laying down in the back of any truck or van or anywhere. So very, very important.
Remember, the 10-15 minute ride to the surgery isn't going to do anything.
Right.
If you had a BBL or anything.
Absolutely.
So your safety first. And in Florida, trust me, when driving, the drivers here are. I haven't seen anything like it. It's you want to have that seatbelt, in place.
The hotel is literally a little bit under 3 miles from here. We will, obviously take you through inside roads. We don't take any freeways or anything that is necessarily dangerous. So it will be a pleasant ride and very safe. And you're gonna be in a very brand new, one of the highest safety standards in the industry for this vehicle that you're going to be transporting you. So believe me, it's not usually like this, but this is super nice. That's a good thing that our patients are going to start benefiting from. Loving my results. Choose Dr. Palladino as my surgeon and the best decision. That's awesome. Thank you so much. You are those shy. You guys don't want to interact with me. You don't want to show me your results here.
I know. We'd love to see the
make your appointment. How do I make an appointment in person for a consult? How much would it be? So that's a great question. Anybody that is looking even for an in-person appointment has to go through the website and send their online consultation. So that's the way we register in our system. We want to see also some photos. So we are going to make sure that you're going to be coming for an in-person consultation, but you're an appropriate candidate for that, because you might not be an appropriate candidate for that yet. So we want to at least rule out that we are not going to be wasting our mutual time. So we still submit your consultation. We're going to see what you're interested in. We're going to see some photos. We're going to see your weight range and see, your medical conditions, at least the few, and then we will put you in contact with other coordinators who will, just coordinate an in-person if you're appropriate.
And Debbie asked if we can she can do a virtual consult. Absolutely, same thing, same process. Send your photos, and whoever you choose as your surgeon or would like to one of us will definitely, we can do the virtual with you.
Yeah, let's see. It's awesome. Here we're in TikTok. Thank you very much. Yeah, I guess the van is super nice. I was playing with the recliner seats and the footrest and all of that, and oh my god, that's so comfy. I really want them to go and pick me up in the morning, but they're usually picking up patients. Patients are the priority.
Well,
are you doing consultations live? Sure. You just had to request to come in, and we're happy doing your consultation live. You have 2 plastic surgeons here.
Yeah, absolutely. If you have a quick question or want to show us something, now's the chance to do it quick. And
Leti pregunta, she's asking why we don't do lives in Spanish. ¿Por qué no hacemos libros en español? Te prometo que vamos a hacer uno pronto. We're gonna do some lives in Spanish. That's a good idea. We used to do it, especially Wednesdays, but we're gonna plan one of these ones and do it Wednesday. Vamos a hacerlo con Dr. Sam too acá. Vamos a hacer un live en español.
Necesito aprender. So.
Exacto. Okay. Does red light impact BBL results negatively? I guess you're talking about red light therapy, right?
Yeah, I think that's what they mentioned.
Yeah, red light therapy. Yeah. I will say that depends on what stage you're doing it. Obviously, after 6 weeks, I don't think it alters anything or it's gonna be worse. In the early phases, where there's a lot of swelling, maybe the first week might not be recommended. But after that, if it helps with inflammation or so forth, I think it would be probably okay. I mean, there's no scientific data that I'm aware of that that's better or worse. So
I don't
can't tell
either. But as you said, after a certain amount of time, I doubt. Once you get good blood supply to that fat.
I never thought in a BBL until I saw a simulation. It's amazing. Thank you so much, because you bring up an excellent point. The reason why we do the simulations is because a lot of times patients mistakenly think that we recommend a BBL because we want to have their booty bigger. And that's not the case. We want to have a BBL because we're going to shape your body better. And the simulation will show you what we mean about that. And that doesn't mean that you're going to end up having a big booty. On the contrary, you're going to have a much better body contour. Sometimes we use a little bit of fat just to fill in, let's say, your hip dips or certain areas that are going to give you a better result overall with your procedure. So thank you for asking that, M80J, because I think it's important. The simulation is there for a reason. Let's see, we'll go with Mari. Mari maybe wants to come in here live with us. Maybe she wants to do a free consultation or show us her results. Kind of make an in-person comment. How we answer
Just
that.
Fill out the form. The coordinator will reach out to you.
It's Mary there. Mary, we can see your ceiling, but we cannot see you.
Sorry.
Now we can see your computer.
I wanted to ask. I don't know how to work this. I've never been on the live.
Okay. There should be a button that says reverse your camera, but that's okay. You can ask us.
There you go.
Hey.
Hi.
I wanted to ask what your procedures are for eyelids and your neck.
Good. That's awesome.
By the way, I got my body done by Dr. Palladino a year and a half ago.
That's
Very
awesome.
Great experience.
Awesome.
Great. I see you are at work, so you probably can't show us the full results, but that's good.
Yeah, I get it.
Listen, for the eyes, I can see that you have a little bit of excess skin on your eyes. Do you have? I mean, absolutely. We call it an upper blepharoplasty or eyelid lift. Eyelid lift. You know, we remove a little slim piece of excess skin that you have in there. Sometimes we have to remove a little bit of fat, depending on you know how it looks. And it's a simple procedure actually, and the recovery takes maybe like 2 weeks at the most for that. Maybe during the first few days, you're actually gonna be good, and it's very rejuvenating for your face because you know when the skin starts laying down on your eyelashes, and then it gives you problems with makeup and all of that. This is the right thing to do. Yeah. Now for your lower eyelids, a lot of times we have to remove a little bit of fat. You know, I have to probably look it better, but you might be.
This?
Yeah, so that's different though. That is called malar bags, and for that sometimes we have to just do a little bit. You know, we sometimes do a little bit of what we call a cantopexy. So we bring your corner of your eye up a little bit, and that tension will help this. And sometimes we inject fat in the front of that. You know, those areas are actually a problem with lymphatic drainage in your eye. So it's not something very easy to correct. But if we inject fat right in the front of it, and we do a little cantopexy, that helps a lot with that malar bag. Yeah.
Because I'm always thinking, like, should I get an eyebrow lift?
Correct.
And
very unlikely that you will need that. Very, very unlikely. It doesn't seem that your brows are in a bad position. You can always do a brow lift through the incision of your upper eyelid. You know, like I like to do it. Once we open the skin here, we make a little pocket and we suture your brow slightly higher. Some patients or some doctors do it through little incisions here. You know, but your brows don't seem to be very low. And a lot of times, you know, with the eyelids, once you do your eyelids, your forehead relaxes and it's good. So, but we have to lift it, we'll lift it. Send us a consultation.
That's my boss.
Hey, we're doing it.
This is Dr. Paladino.
We're live.
Paladino. He's yeah.
Good. Can you tell me what's wrong with this? Oh, just kidding.
It's my consultation.
That's right, live consultations.
Or am I insulting your consulting?
No. And how about neck?
Yeah. Your neck doesn't look that bad actually. Maybe just some lipo. You know, lipo and J plasma will do it. What do you think? I think
it's hard to tell because we can't. The comments are, but
yeah, I mean doesn't seem that you have a lot of excess skin.
Lipo and J or a mini, you know, sort of, you know, lift, but just the J plasma will help a lot actually.
I mean, 50, I don't want to grow old with this chicken thing.
No, well, no, that's a good thing. Like you know, let's see if we can put you here. Let's see, 1428. I'm gonna see if we can put you in the big screen. Maybe not, but can you see yourself in the back there? Yay! Yeah. We can see you there now. So yeah, so you don't. It doesn't look. I don't know if you, so everybody else can see what we are doing here. But your neck doesn't look so like it doesn't look like you have a lot of excess skin. So sometimes lipo and J plasma is perfect for your neck, and we can definitely do that when you do your eyes on fat grafting. And that's what you need, and it's gonna buy you many years of what you said. You know, like having that. Once you start having a little bit of loose skin, then at that point you can always do like a mini facelift or a neck lift. You know, if your face is good.
And do you have to go 100% under, or is that like an office consultation?
I think for your comfort and mine, it's better to be under. Although the recovery from this is pretty simple because it's not a very long procedure. You know, the shorter your procedure is, the faster you recover from anesthesia. So, yeah. I mean, even if you go under, it will be easy recovery.
Okay. All right. Well, thank you so much.
Mary, send us pictures. Thank you for
thank you to your boss for letting this happen.
Absolutely. Say hi to him.
That's a cool boss, right? Absolutely. All right. Take care. Bye.
Let's go here. I'm gonna bring this again. No, sorry. Yeah, you can go ahead and do that. And then I'm gonna try to see where I lost my. Let's switch. See if this will bring our TV back in there. Okay, great.
Pricing for a facelift, just, send the consult and the coordinator will reach out to you.
Yeah, it's very hard to tell you because I don't know exactly everything that you will
Right.
need. But yeah, but it's cool. See, you guys can enjoy the benefit of doing free consultations.
And your bosses don't mind, apparently, so you can do it at work. We're not responsible for any post job.
Yeah, you need to keep your job to pay for your plastic surgery, though,
Right.
so don't overdo it. Dr. Paladino, I think I can be back to work office in 2 weeks after mommy makeover. Yeah, it'll be pushing it, but depends on a few things. 3 weeks will be better, I'd say. 2 weeks will be, it's possible, but it's cutting it a little bit too short. Obviously, I'm talking about like an office job, not
Right, where you're not really active,
Yeah,
you're not like a police officer or something having to chase, criminals, but
right, or an ER nurse, or one of those, or a waitress. I know that these jobs are really demanding, like physically demanding. So for those things, you're probably gonna have to wait a good maybe like 4 to 6 weeks.
yeah, it's just, we don't want you to get your, a lot of swelling, you increase blood pressure. It's just, we want you to have the best result.
Consultation time to surgery. I would say the shortest is about a month, in order for us to complete safely all your preoperative workup. So yeah, 1 month. The shortest.
Yeah, I mean, if you can you see your doctor, get your clearance, do your, whatever EKG if you need to, or mammogram or ultrasound. If you can do all these things quickly and you're relatively young and healthy and, no medical issues, sure.
Yeah.
But it's really up to you. From what we've seen,
Yeah.
average about 4 weeks. But if you can do it sooner and you're in a rush, absolutely.
Yeah, if everything's fine. Again, the least medical conditions you have and the younger you are, the fastest probably, all of this is doable. You have a full year though, from the day you book with us, you have a full year to complete your procedure too, which is another, I think, good thing for everybody to know. So once you put your deposit, you still have a full year. So if let's say you have to lose weight, or you're planning something this summer and you want to do your procedure, let's say next March, then if you book now, you still have until next May to complete your procedure.
Yeah, and I know a lot of people with summer coming, they want to, get it done and recover. So now's a good time, so you have that recovery. And I think I posted something on my Instagram regarding a timeline for a mommy makeover, important dates like New Year's, July. It's pretty informative, just to give you a rough sense of when you can do your surgery and sort of feel good to go by a certain event or timeline. So you can check that out as well.
Yeah, Doctor's Amazing. Follow him, Instagram, look him up.
So amazing with an S.
Yes,
Dr.
exactly.
Samazing.
Samazing. Can't forget about that. I think it's a great name. Yeah, it's like, let's see. By the way, let's talk for a minute about our weight loss program. Weight loss program that we have goes through this, type of drug similar to Ozempic and Saxenda, and it's using semaglutide, which is this hormone similar to insulin, that regulates the insulin and also regulates your appetite. It's something that is proven to be extremely safe and extremely effective for weight loss. It's not something that you should be on it forever, although you could, but you shouldn't. You should try to use it until you reach your goal weight, and then try to implement those changes that you had while using those medications in terms of habits, eating, and all of that. And if let's say that you have your surgery in like 3 months or 4 months and you still have to lose 10 pounds, 20 pounds, this is an excellent way of doing it because it's super effective. Our patients are losing about 10 to 20 pounds per month.
Really surprising how quick patients lose weight, and there's very little contraindications. I mean, the main one is having some sort of familial, thyroid, condition, or a cancer, more to say,
Right.
And very few people obviously have that, not just a general thyroid issue, more of a genetic or a cancerous thyroid issue. So main side effects, GI issues,
upset.
So I mean, absolutely. If that's something you're a candidate for, it's a great way to meet the BMI requirements that are sometimes needed. So.
And your coordinator will guide you through this and then hook you up with our med spa, which med spa Dr. Faith Finolich is the one, just doing your operative evaluation. Remember, we will see you here in a few months, so we will do an initial appointment. Initial appointment will be virtual, and then we will see you here when you come to do the follow-ups for that, so we can guide you and we can ship you your medication. It's a weekly injection. We'll give you a tutorial how to do it, but it's rather simple. And it's a great way, to lose weight if you are in the process or you need to lose weight and you didn't know about this. And the other thing is, like, the med spa that you're gonna be visiting, you check it out, because I'm sure you're gonna want to have at least a hydrofacial done.
I know.
You and your companion, because it's such a nice place, and these ladies are amazing. They're really, really, it's a beautiful team. They're gonna treat you so nice. And why not get pampered? So I think it's a good thing before and after surgery. But you're gonna be there the day before surgery for sure, doing your pre-op, and you could have like a nice service, either Botox, fillers, like a hydrofacial. You can have IV therapy, which I think is great to add that on before surgery. We can definitely give you IV therapy after surgery. So it's great.
Yeah, and we do consults there as well. I live 2 blocks down the road from the med spa. So there's been times when I'm driving home and, Leandra or somebody say, hey, can you do this consult real quick? This patient has her partner or so. And I'm like, absolutely. So I stop by there, do the consults, not a problem at all. So definitely, it's a great place to check out.
That is extremely convenient.
Yeah.
Dr. Nasseri right there. Now everybody's gonna be calling him, hey, it's 2 a.m. in the morning, what are you doing now?
Yeah, maybe not after hours or on weekends, but any other time, that's okay.
So, it's been an hour. We talk about a lot of these things, new transport, the current special going on, which, you guys should check Dr. Zamazing on Instagram. The current special is for the Mommy Makeover for $9.99 with Dr. Nasseri and Dr. Morales. Check it out. We have it posted in our Instagram. And I don't know, we've been answering these questions. Thank you very much to everyone for logging in. Thank you for you guys bringing always your amazing comments and questions. I think they help.
Yeah, absolutely. Maybe next week we might talk about this special garment.
Oh yeah.
Either next week or the week after. I don't know. We'll try to get one of their reps maybe to kind of talk to us live if possible. We'll see.
We have some cool stuff here, but we can show you next time we'll show you some of the cool stuff we're working on if you want to know exactly how many inches your body changed.
Really cool.
It's actually cool
with an app on your phone. So
yeah.
Good stuff.
We'll show you more. So
add
stay
that to
tuned.
the goodie bag. Yeah,
that's right.
It's the best goodie bag ever.
Yeah, well, thank you guys. Thank you so much for tuning in. We will be around here, so if we didn't get to answer anything, check our YouTube channel. Amazing. Subscribe. You're gonna get a lot of the things that we release, on a weekly basis. You can check out all those videos to answer most of your questions. And if you still didn't find your answer right there, you can always DM us. We'll definitely answer this, and we'll see you next week.